Hey, I'm Jansen Bork, and this is a public service announcement on non-gonococcal urethritis. Well, the first thing you might ask is, what is urethritis? Well, urethritis is the inflammation in the urethra. The urethra is the tube that carries urine from the bladder out of the body. The inflammation is usually caused by an infection in the urethra. The term non-gonococcal urethritis is only used when the condition is not caused by gonorrhea. Non-gonococcal urethritis, which is also referred to as NGU, is a sexually transmitted bacteria or virus that can be passed on during vaginal, anal, and/or oral sex. Most germs that cause NGU can be passed during sex that involves direct mucous membrane contact with an infected person. These germs can be passed even if the penis or tongue does not enter into the vagina, mouth, or rectum, even if the body fluids are not exchanged. People are at a higher risk of getting NGU who are under the age of 35 and has recently changed sex partners. People who have unprotected sex are also more likely to get NGU. The most common NGU is chlamydia. According to NHS Choice's website, chlamydia causes up to 43 out of 100 cases of NGU, but half of the men who have chlamydia do not have symptoms. Other viruses are Ureaplasma ureticulum, Trichomonas vaginalis, the herpes virus, which is rare in this case, or Mycoplasma genitalium. The symptoms in men who have NGU include a painful burning sensation when urinating. The tip of the penis feels sore or irritated, or even a white, cloudy discharge from the tip of the penis occurs. For women, however, they will have similar symptoms as the male. I found some pictures online of infected people, and of course online they have the worst symptoms ever, so be prepared. Non-gonococcal urethritis is usually caused by an infection in the urethra, but not always. NSU is when no infection can be found. There are some ways NSU can occur: an injury from a catheter that is inserted into the urethra, a urinary tract infection, an inflamed prostate gland due to bacteria, or surgery to the urethra. Another way non-gonococcal urethritis can be spread through a non-sexual action is by giving birth. Infants may be exposed to the germs causing NGU while passing through the birth canal. This may cause the baby to have infections in the eyes, ears, or even the lungs. According to the Infectious Disease and Antimicrobial Agency's website, urethritis occurs in 4 million Americans each year. The incidence of non-gonococcal urethritis is approximately 3 million new cases annually. Worldwide, approximately 89 million new cases of non-gonococcal urethritis are reported each year. The highest rates of chlamydial infections are usually found in sexually active teenagers. In 2012, Louisiana was ranked 4th in chlamydia, 2nd in gonorrhea, and 3rd in PNS syphilis. In Lafayette Parish, there were 1,244 cases of chlamydia in 2012. And these are not rankings that we should be proud of. Treatments of NGU should first start by going to see a local sexual health clinic. These clinics are free and are available to everyone. The doctor will do a urine and swab test to see if you have NGU. If this is the case, a course of antibiotics usually gets rid of NGU. The antibiotic prescribed may be depending on the bacteria that are found and whether other infections are also present. It is also important to know if that you are treated but your partner is not. The virus can be passed on to you. even if your partner shows no signs. One antibiotic is usually given as a single dose, although sometimes a 4-day course is needed. The other is taken twice daily for 7 days, even if no bacteria are found by the test. You may still need to take a course of antibiotics if you have symptoms of NGU. Infection is still the likely cause, even if a bacterium cannot be identified. It is also important that you finish all antibiotics that your doctor gives you. One way to prevent getting NGU is, of course, being abstinent of sex. Another way is using latex condoms the entire time you have sex. Using spermicides that are water-based can also be used while using a latex condom for additional protection. Make sure you let all your partners know if you have NGU so it does not spread. Having only one sex partner that is uninfected can prevent you from getting NGU. Have checkups with your doctor. Do not have sex if you have an infection until you and your partner has been checked and treated properly. Thank you for watching this public service announcement.